clearly Lawler especially sees that people are going to be pissed when their premiums go up and be pissed with the people who represent them. Is there an argument here that this is way beyond politics, that it's going to hurt Republicans, but that this is ultimately going to hurt the American public?
Yeah, look, I've been clear time and again. I think this is an issue from the subsidies. Well, let's back up. Let's remember why we have the subsidies and who put them in place. If we need to rehash it again, Democrats put these into place. They set the deadline for us all. So once again, it's on Mike Johnson and Republicans to clean up a Democratic mess. Now, here we are. Having said that, I think this is an issue we need to tackle. But I want to say something else about Mike Johnson. All this back and forth about him, I've said it once, I'll say it again. He's the most underestimated person in Washington, D.C. You look at it from the last year, he won the big budget fight and brought Schumer to his knees in the spring. He passed the one big beautiful bill in July, and he just won the government shutdown by keeping them out of Congress, out of session for 2.5 months. He's spent a lot of political capital on that, but guess what? The Democrats caved at the end of the day. So I think we need to give him some breathing room because, look, he has a very small majority. And he has to tangle with a lot of different people. Now, what he usually does is he gives his members room to breathe and air their grievances. On this one in particular, though, I do believe Republicans are going to have to come out and figure out a way to address the subsidy issue one way or the other, even though it is a massive, massive giveaway to insurance companies. This 3-year package that these guys signed on to today, massive giveaway to the insurance companies. And I'm not sure why Republicans would support it.
Go ahead.
Well, I don't disagree with you in terms of Mike Johnson and the way he can navigate. I don't think he is a terrible speaker. I don't agree with how he navigates, but he does navigate. I think that there's a couple things that Republicans are reading this. They're like, Obamacare is terrible. Obamacare is terrible. When you talk to voters and you ask them, take the Affordable Care Act away, they do not want it. Sure, improve it, but do not touch. When they realize Obamacare is the Affordable Care Act, they're like, leave it alone. When you talk to voters and you realize that their premiums are going to go up, their health insurance go up, they say, fix the problem. It can be fixed. This is going to be a really hard sell. And the reason why those 4 people on that screen that you showed broke with Republicans, because there is a midterm election, and they are in Pennsylvania, and they're not going to be able to gerrymander their seats into safety. Mike Lawler's seat is a new seat that was created with New York maps. He is not safe. That is a contested seat. And so he's mad. Yes, I'm sure he cares about the American people having affordable health care, but he's also pissed because he does not want to lose his seat, and this can make him lose it.
Well, I would just say that I don't think Mike Johnson is a terrible speaker when it comes to managing this very small majority. He is a terrible speaker when it comes to being Speaker of the House as a constitutional officer standing up to the President of the United States. One of the reasons he was able to keep the Congress out for so long is Trump doesn't want the Congress to do much. He wants to run the entire show. And he has surrendered the constitutional authority and Thune have surrendered the constitutional authority of Congress. No president has tried to claim as much power without congressional involvement as Donald Trump. And Johnson has let him do that. Would Pelosi have done that? Would Sam Rayburn have done that? Would Henry Clay have done that? No. They knew they were Article 1 and stood up to the president. He doesn't. And that's one of the reasons he's in the place he is.
Pelosi's been too busy making herself, hundreds of millions of dollars trading on inside information. Come on.
Let me just ask you why we talk about all the time. Republicans always say, "Look, this is the Democrats' mess that they made."
That is a fact. That is not debatable. This is Obamacare is them.
A lot of people have issues with it on both sides of the aisle. That is true. But I guess the question is then, what is the Republican plan that you have had, I don't know how many decades, to come forward with to say, here is our robust plan. This is how it's going to work for you, my citizens.
Well, Sarah, I wasn't prepared to address decades, so I'm just going to, I didn't have that on my bingo card for tonight, even though I'm a Wall Street bowler, as you've advertised. I think the reality of it is, and this is part of what the president was addressing directly today, is that we have some systemic failures. We have some systemic inequities in our healthcare system that favor the insurance companies, that make the way the system works a cash grab, as you said, for the insurance companies. Companies should not be able to overcharge by thousands of percent consumers when it comes to prescription medication. We should not be reliant on China for 90% of the raw material that go into the medication that we need and use, and that became painfully clear during the COVID pandemic. And that's what the president's trying to say. It's not just about coming up with an alternative to the ACA, and we need one, that's why, There's so
Clearly.
much on both
where
sides, right?
is
Big
it?
one.
Here's-
But we have to fix the system too.
But
you
where
can't
is
just
it?
Band-Aid it.
Well, the House passed a package just earlier this evening. I mean, the House did address the ACA and made some reforms this afternoon.
They're not paying for the subsidies, so that goes away.
I got it. I'm with
Let's
you.
be real. The Republicans have been bitching about this for as long as I can remember, and there is no real plan. There's not even concepts of a plan. But here's the thing. If you are one of the Americans that is on the ACA, one of the Americans that maybe has a pre-existing condition that's only covered because of the ACA, and you see your premiums skyrocket 100, 200%, and you don't know what subsidies you're going to get, you really don't give a damn whether it's a Republican problem or a Democratic problem. You want it to be fixed. And let me tell you what's going to happen, because I have been talking to people who have told me they're going to go naked. They're not going to have health insurance because they can't afford it.
It's a lot of people
That
like
means, and this strikes home to you, strikes home to me, because we've suffered with cancer, our families. It means that instead of finding cancers at stage 1, people are going to find it at stage 4.
Yeah, it's
It
horrible.
means that instead of having treatable cancers, they're going to have cancers that are not treatable, and they're going to die. So if we don't get this fixed, and it is negligence, it is inhumane for Mike Johnson to be sending Congress home at a time when we don't have a solution for this. The open enrollment ended 2 days ago if you want to have health coverage starting January 1st. I mean, I am not going to call him a good speaker when he's doing what he is doing today, sending
but
Congress
Anna,
home
it also-
when there is such a crisis for this nation that remains unsolved.
The subsidies are a crisis for the nation. I mean, if Obamacare was doing wonders, we wouldn't have needed subsidies in the first place. That tells you how bad Obamacare
It's not a
is.
crisis. I would just say that President
The
Trump's
premium
credibility on
going up
this.
and there's no subsidies is a crisis for the
Why
nation.
is this
President Trump's credibility
Jerry,
on this
go
is
ahead.
very, very bad. Jim McGovern, the congressman from Massachusetts, stood up on the House floor today and he read all the times that President Trump said, we will have a plan soon, pretty soon, within the next 2 weeks, within the next 4 weeks, by Sunday, within the next month. And there were a dozen. It took him 3 or 4 minutes to get through all the times President Trump has said, we have a plan, it's going to be amazing, and I'm announcing it at the end of the week. I'm announcing it next Sunday. He's a flim-flammer on this issue. He doesn't care about it, apparently, to get anything together. And the Republicans don't have a coordinated strategy on one of the most important issues in American life.
Obamacare became the law in 2011, 2014. It is 2025. It has been 11 years. Where is the plan if Obamacare is so bad? Republicans have voted on it 63 some odd times and without any counter, and it's failed because why? Actually, Obamacare is better than what it was before. I also think, to your point about catching cancer at stage 1, I've been sitting at this table before where they say emergency rooms are flooded with people who don't believe. You know what an emergency room looks like when people don't have a primary care physician to go to when they have a cold to get a prescription and they have to go to the ER, how hard it is for nurses, for doctors to actually give quality of care when they're already overtaxed, overrun, and then the bill you get when you leave the emergency room. My mom was in the hospital and her roommate was a Trump voter, and he wanted his wife had a stroke, and he wanted his wife to leave the hospital and they were on Medicaid because of how much the hospital was going to charge before Medicaid even kicked in. These are Ohio voters. This is Trump country. This is a crisis.
Let me be clear.
Beyond Obamacare.
None of that's okay. None of that's okay. I'm not cold-hearted. I'm not without empathy. And what the president was trying to say today, instead of fixing the symptoms, right? Instead of trying to patch it up here with a patchwork of ACA or some form of ACA, let's fix the systemic problems with our healthcare system that incentivize the corporations to not find a cure for these terrible diseases, to prolong how long you're in the hospital, to give you this patchwork system of healthcare that does not make sense, that lets the insurance companies and the drug companies to rape and pillage. That's what the president was addressing today. Let's fix the root of the problem, not just the symptoms.
But
Okay,
when?
hold on.
Because
He had- hold on.
hold on. 2 days ago.
We're going to
I'm
stop
pretty
this
sure he
here,
told you.
but he has had something around a decade to try and come up with
You
a
told me
plan.
no decades, Sarah. We had an agreement.
I agree to
4
nothing.
years before. I mean, that's not a decade.
Thank you so much, Mark, for being here.